wanted to see us to watch this one last, and then we go into other details so that we can get what the other one had gotten done. And it is really bringing the different perspectives of what public health is all about, and it is very, very important for us. So meanwhile, Derek, I want to post, when it comes, I'll post the PowerPoint for you to get it over there, all right?
Public health is a vaccine that prevents disease.
I think that one we are done.
Who discovers the source of a salmonella outbreak?
I was sharing the other one. I hope this is the one. Sorry for that. No. Okay, sorry. This should be the one.
Improvements in life expectancy are slow, and we do not live as long as people in many other.
So I think that one was,
We are
there is
not
another.
seeing the PowerPoint. It's one that you display.
You are seeing the PowerPoint, eh?
Yes, not the video.
Okay, but the video was bringing to us to really understand what is really public health from different perspectives and understanding. These two kind of YouTube videos are trying to bring to us to understand that one clearly. And but I wanted to cross it to this area that whenever we talk about public health, what should come in mind is the issues of research, where people come and identify a number of problems that at hand, the health needs of the community through community situation analysis and needs assessment, and they are able to attain that and be able to kind of look for possible solutions, and then they can promote the health of individuals. They continuously collect data and monitor intervention that they put in place, and then continuously monitor those interventions. Then they keep on analyzing data, come up with the statistical values, and are attached to make sure that they make conclusions. And then they always look at outbreaks. They are able to see how can we prevent diseases. They keep on communicating this information to various stakeholders within the country and all over the world. And then they call out emergency preparedness based on the analysis they have made and the history that they are getting from various diseases or conditions or problems that they cover. And they always ensure recovery, and then ensure environmental health is guaranteed. So when you look at all that entails public health, and it brings it to a different glass. But in a nutshell, it is basically many people call it a science of protecting and improving the health of people and their communities, wherever they are in various aspects. Once the communities or individuals are protected against a number of health hazards, a number of problems that may be affecting their well-being, then one would say that is public health. And therefore, public health is achieved by either promoting health lifestyle within the communities, and then researching diseases and injury prevention. And then we see detecting and preventing and maybe probably responding to a number of infectious diseases within our circle and within individuals. But again, they even keep on saying that it is always concerned with protecting the health of entire population, not individuals. And that's why I started with something that was showing something regarding the population which is coming from individuals. So these populations can either be small as a local neighborhood, if you have your neighbor. It could be as big as the entire country, or it could be as big as the region of the world. Therefore, you realize that when we talk about public health, we are looking at the sum of all official or governmental efforts probably that are put together to ensure that the well-being of the community, the health of the communities, the health of individuals and the public is well preserved and maybe protected, and is well promoted to ensure that people live a high, sound life and happy all the time. If you take back to the WHO definition of health, then it helps you to understand that really when you go beyond those factors, you'll be able to appreciate what public health is. What about the Oxford perspective of public health? It is calling it a science and as well as the art of preventing disease, you are prolonging life and promoting health and efficiency through an organized community effort. So communities come together to ensure that they do whatever they can. They ensure that whatever activities, whatever issues that they handle within their communities is aiming at preventing the occurrence of disease. And as they are doing so, they are likely to prolong their well-being, they are likely to prolong their life. We see longer lifespans, people having longer life stays within the communities, and you find they have very many elderlies as compared to maybe to the rate at which people are dying. And of course, once there is health being promoted within these communities, there is a likelihood that efficiency and through out very well. Therefore, that process of mobilizing and engaging the local, the state, the national, and the international resources in order to assure the conditions in which people can be healthy is what we refer to as public health. So whatever they do to mobilize, to engage local communities and different stakeholders within the communities, it will always be looking at what we call the Oxford perspective of public health. But American perspective of understanding what public health is, they don't retaliate so much from the Oxford. They also call it a science, and a science and a practice of protecting individuals so that they can improve their well-being. So if the communities, they are healthy, maybe clearly, I think Derek, you'll be able to monitor the chat because I can see the chat is well populated. You'll be able to note a few of those things. Slides are not moving. I think that way. Are they moving now, Lwenge?
No, it has just been on the introductory part on this kind of drawing.
Oh, okay. So let me share again. Let me stop sharing, then I share again for you to be following. Sorry for that. So it has been stuck here.
Yes, that's where it has been.
Oh, sorry. So that's where it has been, yeah? Yeah.
Yes.
So I've moved through this because this is what sorry for that. Thank you. Derek, that's why I said you need to monitor the chat so that it doesn't bore the congregation. Okay. Thank you very much for that. Now, are you comfortable? Is it moving now?
Not yet.
I
What
was
about
suggesting
now?
you can put it in the slideshow.
No.
Okay. Let me stop sharing, then I share again.
Yeah, there it's okay.
Yeah, it's okay. Okay.
Yeah.
Good. So are you seeing now movement? Derek, is that okay now?
Yes, it is, but I would like you to put it in a presentation mode or slideshow.
Oh, my side it is.
This side is not.
Mathias, I think you're having challenges with your bandwidth, so you may have to send Derek to project the slides.
Okay, that's fine. What about now, Derek? Are you seeing it?
It has spread.
You're putting, okay.
Derek, what about now?
Not yet.
Okay. Sorry for that. Let me show again. I'll open it again, sorry. What about now, Derek?
There you go.
Okay, thank you. Okay, so I was talking about the American perspective before I saw what was in the chart. And I was saying that for them, they see it as a science and practice of ensuring that the communities are well protected regarding the means of improving their well-being through physical, mental, social, and all aspects of health, as well. You know that WHO definition of health as by preventive medicine. People are looking at all forms of maybe elements of primary care, the health education, control of communicable diseases, application of sanitary measures, monitoring of environmental hazards. All these come into play, and they are able to appreciate what really public health is all about. So it shows to us that public health is widely kind of looked at in different perspectives. What about the society's perspective? You realize that public health is what we as a society do collectively to ensure that all the conditions in which we live are healthier. Or in other words, we are looking, if the moment we see that within the environment we are in is encouraging us to live a healthier life without contracting diseases, without getting injuries, you find that a place where to live and you are a happy individual, you do your activities safely without getting any injuries, you'll be saying, yes, this is probably public health. And actually a community looks at it as in an ergonomic manner. And in most cases, wherever the communities look at an area which is so clean, and you feel like even sitting on the floor without thinking that they are going to dirty themselves, even when something falls on the floor, you feel like picking it and continue eating. And where people normally say that germs are not aware before you pick it quickly and then you're able to eat. But if you are at an area where you feel like it is dirty and maybe your pancake has dropped down, you may not be able to appreciate. I've seen people taking selfies in toilets, public toilets, which are so clean, like from Serena and what. Find some people even yearn to read the newspapers from such areas and feels like, yes, the place could be healthier. So, but the public health is probably takes it to be also science and art of saving the lives of millions at once by single decision or intervention. When the decision is made, like immunization against COVID-19, the society will see that probably they are helping them, and the magnitude of the problem will be reduced amongst the population that is at hand. And then you'll find that people are happy and really live a positive life. And you can see how those Western countries are now enjoying watching football freely without using a mask, without any kind of that, because of the intervention that was done, maybe put in place like vaccination, and everyone has now been gotten his shot and is healthy, and no activities are moving on smoothly. I want to also to call to your attention that these issues or these elements make up what we call public health. From the definition we have seen, there must be a system of activities or a system of things that how they are done. And you find that if there is no a system that is put in place, in fact, in most cases, when you want issues to move and issues to be maybe at your side, even if it is at your workplace, you must have a system that if we want to do ABCD, this one, you go to this place and it's like a protocol. So if a system is clear, everything will be fine. If you know that I'm having malaria, I first go to this place and then I go to the other facility at different levels, the system is well established. So you find that public health has a system that if we want to control these particular conditions, these are the areas. If you want to construct a house probably in a certain area, you need to first get maybe a plan. You must go to the areas where they approve the plan, then the people come to inspect the site, people take soil profile and examine. Though that is concerned, and you will be able to see that there must be a well-defined characteristic, a well-defined qualification, a well-defined kind of knowledge, of body of knowledge that a person has to get regarding public health, so that he's able to administer at a certain level. You have a scope for that particular area, so that you find that it makes up what public health has to cover. And when you go to school and you don't have some of those elements, so doing things, and of course you should be fitting more in government services that are promoting the well-being of individuals, and there are many others as we are going to see. And then health of the public is very, very important. How are people living in a society? Are they well off? And there getting what they need to promote their well-being. If the community is not healthy, we talk of herd immunity, where a majority are protected against a particular condition, and once they're protected, then we are seeing some important kind of innovation, and you find people are living healthy and they're productive to the society. Basically, when we talk about the system of public health, this constitutes it. For example, if you are assuring the condition of the population for them to be healthy, we have a community at hand, and this community we have at hand, it should be a healthier community constituting different people within a given locality, and they have different characteristics that they are portraying, different beliefs and norms and values that they have. All these will automatically affect their well-being. But above all, we need to have the healthcare delivery system. As I told you, different levels from health center 1 up to health center 3 up to health center 4, and so many other things, that you realize that we have a challenge that someone who has malaria or just a small cut wound, he rushes to Mulago, which is a national regional referral hospital. In other words, he would have gone to the health facility first, then they give him the first aid treatment until they are failing to deliver the service. That's when someone will go to Mulago. But you find Mulago overcrowded because even malaria is brought to Mulago. Ideally, a clinical officer from health center 2 or 3 should be the one referring the patient who has failed to be managed in those health facilities. So there must be a well-defined health system, and then you'll find everything is working on well. Employers and business, of course, we need people who will employ well, know that once many people are not employed, there is a likelihood that they are likely to have a poor socioeconomic status. And once you have a poor socioeconomic status, depending on your level of education, depending on your employability or employment status and your income, you are likely to face a lot of challenges, and you will not live a high quality life. You go for treatment, and then maybe you cannot afford treating, or even you want preventive interventions like I could call them, maybe you want to buy a certain meal or food which will promote your well-being, then you may not be able to do that. Then the media, if you want anything to be spoiled within your interventions that you are implementing, you mess up with the media, because media has gotten a lot of influence to the community. And once the community is not is hearing so much to what the media is saying, take social media and mass media using television, those are mass media issues, radio. So if the radio talk show is campaigning the intervention like vaccination, just know that people will not go. But if media has been, that's why they have UCC, and then they are controlling them. Otherwise, you don't just air out anything. And you have had many things that are being aired out on radio, and they are controlled. So if media is not controlled or not brought on board, they are likely to entangle the plans, and the system will be down. Then the academia. People who are in academia, if for now I'm teaching wrong things, you'll be able to, to be misled. And then as I'm giving explanations, they're not even relating to what we are really talking about. Academia, they are dealing with the research. If they bring out concocted research that has been plagiarized, people sit under the tree and just Xerox or plagiarize people's work and then bring it on board, and they call them, it's their work, without recognizing them as you put some kind of references that this is not my part, but I obtained it from this kind of area. Find someone has a presentation, but they cannot even recognize the source where he got the information. That will be plagiarism. He has to declare that this material is not mine. But of course, where people can come down and without kind of thought through research, and then someone just writes the statement without even having evidence, because you did not have even enough sample size, it affected your study findings. You are busy jubilating that these are the factors that are contributing to maybe unwell-being of communities, and then you are misleading the community and the country at large. By the way, even the government kind of public governmental public health infrastructures. If we do not have infrastructures that are really looking at promoting health, if we look around everything that we have at hand, the roads, the hospitals, the markets, everything rotates around. So if we do not have infrastructures that are going to help us in the promotion of health of individuals in the community, then we are likely to fail. I want you to relate something between public health, that is PH, and the medical approach model, or could call it. What does this, what do we see here in the image? Anyone who can help us at DSC, basically, before we go to differences between public health model and the medical model? Can it give us something related to that? Just a simple glance without pinpointing to anyone. Please feel free to share.
Okay.
Yes, Ivan.
Hello.
Yes, Ivan, go ahead.
Yes. What I can see from the public model is it's looking at the general population at large. Whereas when I've asked through the medical model, I'm seeing looking at the individual person.
Mm-hmm. Excellent.
Then generally, that's what I can draw.
Excellent. That's very good. And it gives us a picture that really we are in for it. And when we talk about public, we are looking at the totality, entire population, everybody, many people. But when it comes to medical model, that is one perspective. I think other members are saying the same what Kayondo Ivan is saying. Thank you very much, Kayondo, for enlightening the community. I want to take it to this. Basically, as I said, the first point from the pictorial is showing that public health model looks at the population. Many people are being catered for, and when you are trying to promote the health of individuals, there is a saying that the benefits of educatee are not only confined to the educate or educated one, but also those who are not educated always benefit. An example is this: if you go to school and study, you are likely to have a car. Now, the person who doesn't have a car, you are going to give him a lift. So when you give him a lift, he has benefited from your education, yet he did not pay for your fees. But maybe he was paying for your fees by paying tax. And just give an example: if you are rich and people who are near you are poor, because you're educated, you are able to have electricity. So you put security lights. When their paraffin is over in the can, maybe you are likely to share the light with them, and they will be able to eat their supper very well with your intervention. Sometimes, if you are rich and build a fence around you, you can create a fence for other people also, and that is a form of security. If they are guarding you, so you find that public health looks at all that. Everybody should be benefiting from the cake. But in medical model, usually it looks at individual. Yes, one would say, but we normally also all of us go to the hospital. But in most cases, they manage you as a case. But when it comes to population or public health model, we want to manage you as a group. But individual, you come with the malaria, the other one comes with the gonorrhea, this one comes with the COVID-19. So the way how they are managing COVID-19 is totally different from that. So disease prevention is mainly more in public health compared to medical model, where we make diagnoses. We check your blood in a medical model, and then we tell you, please, you have HIV. So let's give you ARVs. So we make diagnoses in the medical model. But for us here, we want to see if it is public health, we can bring in the element of checking for you, screening for HIV, and then we are able to tell you, please continue using a condom safely, and the other means of ensuring that you prevent the disease. Health promotion, okay? And the health promotion looks at empowering the community members to take control over their well-being. If you make intervention, whatever you do to ensure that someone is empowered with the knowledge, someone is empowered with the skills of maintaining his well-being, that is now health promotion. So eventually, if someone is able to take control over his well-being. We shall see there are, of course, spheres of health promotion, like health prevention is part of it, health education is part of it. Those are some of the spheres of health promotion, and health protection, of course. But besides health promotion, for the public health perspective, we see in the medical model, we are looking at treatment. So treatment is what the mainstay of medical model. Well, many people already, actually, when someone comes to the facility and you don't give him tablets or injections, and actually some tribes, I may not mention them here, they like it cut way. So if you go to them and you don't inject them, if you give them tablets, they will feel like they are not going to recover. So treatment is the mainstay and the model of way of managing issues within the medical model. Then we normally use interventions and mainly the environmental and human behavior when we are dealing with the health promotion, public health. But when it comes to medical model, mainly the interventions are medical care, where you give treatment and other forms of supportive treatment to see that the person recovers from the illness. But of course, as public health states, we see that it is mainly more of public in some private areas, of course, but some public, you find that we also have private kind of medical point of view. So mainly medical is private, but of course we have also some public. Again, some public NGOs come on board to play a very big role as far as promoting health of communities are concerned, but mainly we see public services or public institutions guarding that, but it doesn't stop you from having a private NGO to promote public health. I want you to note that there is what we call tip of iceberg in relation to public health. What a physician sees, what a doctor sees when you go and you are sick is basically a tip of the iceberg. And this is people who come to the hospital are very few compared to those who have failed to come to the hospital because of a number of factors. So what the physician does not see is quite many. And that's why in Ottawa Charter, there was reorientation of health services. They want these health workers to leave their desk and start seeing deep down and go to the community and see what are the root causes of this diarrhea, not just waiting for the cases of diarrhea, which is just a few of those who can afford or manage to come to the facility. So patients in the hospital is just a tip of the iceberg of what the community is really suffering from. So, and patients in this community, they either have mild or no symptoms at all, and some of them are doing self-medication, and others are doing treatment elsewhere. This RX is meaning recite, meaning treatment that should be prescribed, and then the drug to be dispensed. Once you see RX, it is meaning recite. So this treatment, just what it means, and it means any drug that drug is, which we have written, is supposed to be prescribed and dispensed to the patient. So that's what they're aiming at, and the potential spreader. These people, if you remember Typhoid Mary, how she spread the disease to many people, yet for her, she did not have any signs and symptoms of typhoid until, by then, unfortunately, she did not even die of typhoid, interestingly. So she died of something else. You remember how John Snow imagined how people were getting, he was seeing, of course, he started seeing many people coming for treatment of maybe cholera until he identified the pump around, and then he had to withdraw the pump, and eventually people recovered, and majority of them recovered from the pandemic. I want you to note that the main function of public health is to look at the systems management. And mainly, as I told you, that mainly there are 4 areas or 3. Usually there is assessment, and then there is policy development, and then we see assurance. So in most cases, when we look at systems management, people carry out research, and through that, they are able to monitor health sector and how people are living healthier or people are sick, diagnosing and investigating a number of conditions, and they are able to give appropriate treatment as in that case, and they inform and maybe educate and then empower based on what they are seeing, so that the communities live healthier, and mobilize the community partnerships so that they come and work hand in hand or work together to ensure effectiveness and control of diseases. Of course, through that, they are likely to develop a number of policies, bylaws. You've seen as you are moving around, people say, don't urinate here. If you are caught urinating here, you will pay 500,000. Others are saying, don't dump here. All those are bylaws that can be put together. And the number of policies, use of seat belts, use of helmets now, and so many other things, those are all put in place. And of course, we need to enforce the law in public health. So we need to work hand in hand with the enforcers, the law enforcers like the police. So you've seen many people encouraging these people to put on masks, but unfortunately, when they leave the police, they are likely to remove the mask. They don't want to observe the SOPs. People used to use border borders, and when they reach somewhere, they first come off, then the border crosses along with some kind of luggage, as they were encouraging them to carry luggage, and then eventually they join again. Those are all problems. Then the linkage to or providing care. All these ones also come together to embrace, of course, public health, and they assure competent workforce. And we shall see later on from a study that was carried out that is a very big challenge as far as the health sector is concerned. And eventually, we see them evaluating probably the intervention that I have put in place and ensure that all is right. That's what is in this schematic diagram that can describe for us that. Now, but the main activities, basically, we are looking at preventing epidemics and spread of diseases. Like now we've been having COVID-19. It started as just an outbreak within just an area, small area within China. Then it started spreading to the nearby countries, and then it became some kind of epidemic, because it started crossing the countries. Now it started now involving different parts of the regions of the world, and then started calling it a pandemic. So now whatever we do is to try as much as possible as public health specialists to prevent the occurrence of that disease using primordial, we use primary interventions, secondary and the tertiary prevention of these diseases. But we also see it protects against environmental hazards that are within our workplaces. People are doing a lot of work that is predisposing them to a lot of occupational hazards. People are building houses which collapse day by day. You find people are working at the river banks, people are drowning, people go for swimming and eventually capsize the boat, and then you find many of them are enjoying Christmas season, but they lose their life. Then we are seeing responding to disasters and assists communities in recovery. You realize the Bududa landslide, mudslide, and so many other things. Kasese, you heard of, or those floods and so many other things. We public health specialists, we should be eyeing into all that and preventing injuries from occurring, especially at the workplaces and other forms, even the homes and the communities where we are living. Then promoting health behaviors of discouraging people to use maybe to smoke in public, and so many other interventions that you may think of, having safer sexual behaviors and so many other things, assuring the quality of life, accessibility and accountability of health services that we have at hand. The others are monitoring the health status of the population. And we see also mobilizing the community action, but we also look at reaching out to link high risk and hard to reach people that need our services, especially through outreaches and so many interventions. We are seeing researching to develop new insights and innovative solution arrays to be brought on board and leading the development of sound health policy and planning. All these are activities, main activities that people carry out to ensure that. So as a public health specialist, if you really feel like you can concentrate in one area that really looks at either ergonomics, and you want to promote the health of people who at their workplaces, and that is your, come up with your NGO and something that can promote the well-being. But the great public health achievements that so far we have, vaccination, except of recent when the people were denying, were refusing to uptake kind of vaccination due to COVID-19. It was really a war that it was fought that now people are accepting, and you see within a short period of time, they have brought vaccines, and then vaccines are over. People are now looking for sharing and so many other things. Then motor vehicle safety, they have tried so much. But of recent, what has even tried is you've seen many people because of COVID-19, there are many roadblocks that have been put. So people are now fearing, let me put on my seatbelt, let me not overspeed, because after a short period, is likely to stop me from probably going on to into challenges. Then safer workplaces, many people now are working in safer environment. People now are aware that I'm not supposed to work in an unsafe environment. If you find the chair is bending and you've done some degree of public health, you are likely to know that ergonomically you are going to be affected. So you have a right to ask for the right chair. You cannot work in a place where the toilet is missing and you continuously work. You cannot be in a workplace where they are not giving you NSSF probably. You cannot work in a workplace where they are not giving you food, you are not getting maybe all the leaves that you're supposed to have. People are working in areas, instead they are the ones who are fitting the work instead of work fitting them. So you need to be sure that where you are working is a safer place for you to be. Do not shy away, because at the end of it, the effects you get from your workplace will not, the employer will not mind about you. And many of us, we don't know the policies that we have at hand that usually people don't read until maybe they get you are at workplace, you lose your hand, but you don't even claim for compensation because you don't know the policy. And yet the policies are written there for us to appreciate. You must be knowing which type of chair am I supposed, how many people are we supposed to sit in this office? They should not to congest you because they don't have space. You better be in a safer place, especially now that we have COVID-19. You should be able to fight for your life. Otherwise, no one is going, the moment you die, they will replace another person. So don't risk so much. If you wake up today and you feel like you cannot go to work, feel free to communicate to your boss and say, I'm unable to work because I'm feeling unwell. Even if your husband slapped you at night, or you find that you gotten maybe some kind of misunderstanding in the morning, that is enough not you to drive to your workplace. Please cool down, relax, and say of solving the problem first, then you go. But somebody is leaving a wife who is in labor because the boss is supposed to allow or to welcome him and is going to deduct his salary. Let them deduct 100,000, but your wife is safe because you need a family which is also safe. So as they want you at the workplace, you need also to be safer at home, because when you get a problem, it is your family members or your relatives who will be sitting on you when you get that work-related disability. Control of infections or infectious diseases is very, very important. Now we are dealing with the COVID-19 and people are telling you, put on your mask, you don't want. Other people are telling them, please do ABCD, they don't want. So as achievements have been made, people are now washing hands than before. I've never seen how people these days are clean. During those days, people used even to do handshaking. Do you know why the Queen is ever putting on gloves? He doesn't want to handshake that people, at least the glove will protect her. So all these people have tried, but of recent, in this guise of COVID, people are trying to observe SOPs. Have you noted that most of the coughs these days, the respiratory tract infections have also reduced? And actually, people, you rarely find now someone coughing. And actually, when someone sneezes or coughs, people will think that that is COVID. That is the first kind of impression that one would get. Decline in death from coronary heart diseases and stroke. People have tried to reduce the number of people who are dying. Safer and healthier foods. People have started realizing what they are eating. Now people know before you eat ABCD, you first read. But many of us, we just consume. Even don't know the KFC, which type of oil they have used. These days now, I'm seeing grasshoppers being fried in cooking oil. Yet grasshoppers have a lot of cooking oil. Now you wonder, what are we eating? So meaning people have tried so much to see that they are living a healthier life. Healthier mothers and babies. We are now seeing healthier babies and mothers. People, malnutrition is reducing because of people knowing what to eat. Family planning uptake has improved, and you really see too many, too early, too late, and too frequent are busy being catered for. Too many mothers delivering more than 5 children. Too frequent mothers delivering at a 30 birth interval of less than 2 years. I can imagine getting a baby every year. It is waiting to get babies when you are 35 years and above. That is too late. By the time you get there, you deliver a child with congenital abnormalities and so many other things. Then too early, children getting pregnant at an early age. Family planning has really tried to improve on that, though of recent, because of COVID and the lockdown has caused a lot, but they have improved there. Fluoridation of drinking water. People are no longer getting conditions related to the tooth decay and dental caries, because now people are getting fluoridation of water, and maybe recognition of tobacco use as health hazard. People are now recognizing excessive alcohol consumption and the like. Now, these are some of the common public health problems that we have at hand recently. Communicable diseases are also coming now. They are at a rise. Good access. Many people move long distances to get care, especially when they are looking for free care. Private sector is doing well as far as some of these interventions are concerned, but it's expensive and many people cannot afford, so they decided to walk long distances to go and access health care. Inadequate health care infrastructures. Yes, we find that people do not have infrastructure regarding provision of these services. Many people, you find that you even bypass the facility and you say, but is that a health center? Only to find that if there was no signpost, no one can know if you are not a resident of that place, because you find only one small building which is showing that every service is provided in there. The weak healthcare systems, these are very, very big problems as far as this is concerned, and poor integration of healthcare programs and professional rivalry. People are fighting for professionals who should head what, who should be doing this procedure. You've seen many health professionals maybe fighting for cadres. But based on the 6 building blocks of the health systems proposed by WHO, the leading problems clustered around leadership and governance, and then the healthcare workforce, plus the healthcare service delivery. These are the key issues that where we have a lot of challenges as far as the delivery of health services is concerned. And I want to tell you that these are some of the strategies. If I'm given a chance to lead the health system, probably, or you and me, the leading solutions suggested in here are training and capacity building for health workers so that people are empowered with knowledge, skills, and then they are able to save lives of communities. And reorienting health services will be very, very important so that people look more in the kind of curative rather than looking at the side of, side of preventive rather than looking at the side of curative. And then they will be able to improve the well-being of individuals. Then, of course, increase the budgetary allocation to the health sector would be very, very important. That's why even health workers are rioting because of the poor pay. If they had a very good budgetary allocation, it would be solving a lot of problems, and then it would be just dispersing money and give them the money they need and they will serve diligently. But of course, advocacy for political support and commitment and will is very, very important. Once the political party takes in a lead in improving the health sector, it will be good to go for us. In conclusion, I want to note that the underdeveloped healthcare system in Africa need radical solutions with the innovative thoughts to break through or to break the current deadlock in service delivery. And I want to tell you that this calls for public-private initiatives to be thought of so that they are able to fight and improve the well-being of individuals and communities. 2, we need to have a multinational companies which are extracting resources from Africa, which might be encouraged to turn over and bring back some of these products so that we benefit and some of the profits back into healthcare systems for the health communities, for the communities providing the workforce for the commercial activities will be very, very important for us. But take home, most problems and their solutions lie within human resources, budget allocation, and management. And this should be accorded the highest priority for better health outcomes. I would like to get to know what you want to do for us to discuss the next webinar about public health, basing on what we have seen. And before that, I would like to tell you these are some of the references you can look to and get these materials which I've been talking about. And then I want to thank you very much for that wonderful being a good audience. Thank you. Over to you, Derek.
Thank you very much, Mr. Mathias. We really so humbled and appreciative for what you've done for us. And I'd like us to use the few remaining minutes so that we can ask him questions and then he addresses them, then we can call it a day. I think anyone with a question can kindly raise up your hand, then we choose you, then you ask me a question in the remaining minutes, then we call it a day. Over to you there.
Okay. Or any comment? Yes, Akot, Irene.
Thank you very much, Mathias, for the presentation.
Okay.
I want to inquire if others also want to present what is the procedure.
Okay, I think that's very good. I think you contact Derek. He has put his contacts in the chat. Derek, Akot Irene wants to present something, and that's why he's raising you. So Akot, thank you very much for that concern, and we really appreciate your initiative. Please contact Derek. Derek, you put your contacts again because people might have missed them, so that you embrace that. Thank you very much. Any other? I saw another hand up. Let me see. That is, yes, at Tadeo. You're welcome. Yes, Tadeo, we can't hear you. Is anyone hearing Tadeo?
No.
Mr. Tadeo, I think you have a network problem.
Yes.
Yes.
Hello, Mathias. Mathias and Derek.
Yes.
Somewhere over here.
Yes.
One, I want to thank you for taking this opportunity to orient the team on public health. However, I have just a small concern that in the next presentation, can we look at how do we put public health into practice? Because I'm not so sure about the audience, because currently I assume that the audience is a mixed group, those who have some idea about public health and those who do not have any idea. So what is the take-home message at the end of the day for someone who has no idea about public health? How can they customize it to their day-to-day life? So I think that should be among the pieces for the presentations going forward. Thank you.
Okay, Derek, that is a very good observation. You could work around that corner and get the next webinar, someone talking about that. Derek, have you noted that?
Yes, I have, sir.
Yes, that should be the theme of the day, that particular presentation.
And the
That's
slide,
very good.
you can check the chat. There is a slide which Mr. Mathias have shared. You can utilize the opportunity, or you reach out to me to share the slides.
Okay, that's very good. Any other person? Yes, Lwenge Richard, please.
Thank you, Mr. Mathias. Actually, I have a question. Like, if we can relate what you have been studying to the current situation here in Uganda, where we are having underfinancing of the public sector, public health sector, actually even in the health sector, the entire health sector. Now, what can be done through this public health department, or we, the public health practitioners, to ensure that we guide the government, or we try to show it that there is a need to improve in this kind of under financing, so that we can get better health services. In other words, what can be done by the professionals? How can we approach that to ensure that we bring forth the government to put in more financing in health? Thank you.
Okay. Yeah, thank you very much, Lwenge, for such a wonderful question. And I think I would encourage you to, first of all, we need to do research and have concretized kind of information that we have data, and we are basing on interventions that have been researched and really agreed upon, and majority are saying such interventions can be done. And then eventually we become what we call activists, ourselves, the public health specialists. And once we become activists, we are able now to get our own solutions, and then we now send them to the pragmatisms kind of pragmatic kind of people to use. Those are the leaders in top management, like the parliamentarians, the president, the ministers of health, so that they can help us to take to the next level. But we need to be activists ourselves, and we look for possible problems within the community through community situation analysis and the needs assessment. Then we are able to know that this is what the public really wants, and then we are able to advocate for them, and then try to encourage them and take up intervention that will help us. By doing so, we shall have evidence through writing policy briefs, and then present them to high authorities that will be able to make policies that will come on board and eventually improve on the financing of the health system. I believe once we do that, it will be a breakthrough. Thank you very much for that observation. Any other? Yes, Derek, do you have any other? Lwenge, your hand is still up, or we wanted to end this session right now, or unless you have any other thing. Yes, Okota Isaac, your mic is open. Would you want to say something?
Not so much.
Okay.
Mathias,
Yes.
maybe one thing that you need to clarify is what is the audience for this presentation?
Oh, yeah. The audience for this presentation was mainly health workers who have really gotten some glance from the public point of view. Public health have, at least they have done some health related courses probably, or they have gotten chance to go to a university and they have done public health. So we wanted just to enlighten ourselves like some kind of any webinar or CME, but did not close to the gap to ensure to limit those people who would want to join when they did not have any health related background or maybe the issue of public health background. But going forward, as people are suggesting, is that we need, as the theme suggests, that bring public health to the world, it implies that we need to now incorporate, and as we are trying to educate and the communities that have never gone to school and we want to see how they can appreciate what public health does and the entire community. It would be good going forward that way. If that's why I've projected that what would you want the next webinar to be looking at as far as public health is concerned. And this could be a form of a needs assessment or a community situation analysis that from your experience, like Samuel, what do you have at hand probably within there, that what would you want the next webinar to look like? Yes, I think, have I answered you, Samuel?
Yeah, that's okay. I think that's clearly right.
Yes. Tadeo, you wanted to say something, but you were not clear as far as network was concerned. Are you now better in to give us your submission, Tadeo? Hello? I think he's still unable to tell us. Maybe he's not getting us. Eric, over to you, I think. Derek, would you want to say something?
Yeah, I would like to appreciate you for the time you've given us and the knowledge you've shared with us. And I'll encourage also other members, if they need a slide, then let them contact me. Then others is still in the slide, you can download it there so that you can position to get it. So it's upon you. Either download it in the slide or you can contact me on my emails, the ones I've shared, so that you can make question to you. And then the other thing is that it can even need question to help me to share with you the next information about the next event, which is going to be with Mr. Ijaz. It's also going to be interesting, and I urge you not to miss it.
Yes, and Derek, you should, if you had captured people's emails, it would be better to share with them the audio also. It would be good. But if you can share within ourselves, we shall share it to others. But I've shared the presentation. Members, please feel free to download and use the material the way you want. I wish you well, unless there is any other concern. People are populating the chat. They are happy for us for organizing the webinar. William Onyai says, thanks for organizing the webinar. Could you share the presentation? Yes, I've done. Thank you, Mathias and the team for putting up this together. That is Odong. Thank you. And thanks, members. That is Ramadan. Thank you for joining. He has given his kind of email that we can share with him. Or William Unyai. So maybe please can you please pick those emails so that you share the information. Eric, are you able to pick those emails?
Yes, I am, and I'm going to remain in the chat so that I can push them to send them. But
yes,
I've also
and you have
shared
put it again. Yes.
For those who maybe you have joined later when you are not yet.
Yes, and actually, Mr. Ndego is suggesting that we can talk about the occupational safety and health, a public health concern, I think. But thanks for the presentation. Please, Derek, also note that it could be a very important thing as far as occupational safety and health is concerned regarding public health specialists. Please, that could be a next webinar. And also, you get Irene, I wanted to be part, so you can choose some of those areas and prepare around a few slides for us to share and be able to appreciate. I will be sharing with you. There is another paper which I want to share with you. Let me put it here, I think, in the chat. There is a paper which I read concerning the key challenges that the health sector is facing, and you'll be able to see how they really addressed them. Let me see whether I have it here. Good. As we go along. Yes. Let me get it. Sorry for the delay. Yes, this is the paper. It is a PDF, I think. It is coming. You are able to download it also and read that paper. You'll be able to see the key challenges that are faced in African setting. Yeah, my view of the next webinar is public health view of non-communicable diseases. Derek, are you able to note that? From Taika Dan?
Yes, I am.
Yes, please do that. It is very good for us to appreciate what the community really is in need of. So I've put I've just shared this thing to only Samuel, but Samuel, let me share it with other people. Sorry for that. The article which I read recently, where I extracted some of this information, but it is one of the reference part of our work when you look at the reference list. But if you find difficulties to get this, you'll be able to get it. I think I've posted it. You just click and open that document. It's a very good article where summarized on how people read. Yes, thank you very much, H. Samuel, I think you have again posted it here. I think that is the one, everyone. Yes, that's good. That's good. But thank you very much for joining, and we appreciate your time and your input to get all this important knowledge that we appreciate, and we share the knowledge together. Sharing is